organisms can be contacted has increased dramatically too. So it's very, very important to have an agent that can not only treat infection, but also can protect your own immune system. Because obviously we don't know whether it's going to be the new H7N9 coronavirus, which is spreading across China and the Middle East, and now it's in Western Europe. It will soon reach the West Indies and the continental United States, and we do need to make sure that we can protect our bodies against that, because unfortunately at the moment there's only a small number of cases, but it has a very high kill ratio, and that's obviously something that we need to keep control of to make sure that it doesn't develop into a pandemic. I mean, that hasn't happened for many years, of course.
Dr. Peter, I wonder if I can just come in here for a second.
Of course.
Because recently we've noticed in Barbados and perhaps across the Caribbean, we haven't had figures coming in from the other territories, but we've always been plagued here in the region with increased incidence of dengue fever, and in fact resulting in some fatalities. And I think we've had one death thus far for the year attributed to dengue fever. Now, the product that you formulated, which, by the way, I want you to speak also about the testing of that or some of the ingredients by the CDC in Atlanta, Georgia, with reference to the corona and other SARS-type viruses. But could you say for a second, tell our audience how this immune product that you formulated could help with something like dengue and some of the other immune challenges that we may come up against?
Yeah, of course. Well, dengue obviously is not a major problem in the UK, but we've had a couple of cases where people have come from sub-Saharan Africa with the disease. They have been treated successfully, and the reason for that is that the new immune product that I formulated recently contains three agents that are very, very adept at protecting the immune system and also killing out infectious organisms like the dengue virus, for example. So you've got the stabilized allicin, you've got ester C, which is a good quality vitamin C, and you've also got beta-1,3-D glucan. So that particular formulation appears to be very good at getting rid of infectious organisms, and also, more importantly, protecting you against picking up the infection in the first place. Now, obviously, dengue is transmitted mostly by mosquitoes, and what we have learnt is that the mosquito, when it comes along to try and feed, as soon as it puts the proboscis into your skin, if it can detect, in particular, allicin, then it doesn't like the smell of that, and it takes the proboscis out and flies away. That's even before it's injected the blood thinning compound to be able to take a meal from you. So this is a very good way of protecting yourself from being bitten and running the risk of contracting dengue or any of the other communicable diseases that mosquitoes carry, particularly Lyme disease, of course. Lyme is now very common in the US, Canada, probably in the West Indies as well, I imagine, and also now in Western Europe. So we have an agent here. Sorry, yes. We have an agent here which is now been tested by the CDC, the Center for Disease Control in Atlanta, Georgia. They tested it back in 2002 against the SARS virus. You probably remember that. Mm-hmm. That was another H7N5, I think it was. And basically, there were so many other compounds that were sent to the CDC that we didn't hear back from them for about a year. Mm-hmm. But at the end of that year, they wrote back and said, your material does kill SARS virus. Sure. Now, by that time, unfortunately, fortunately actually, the SARS virus had done its turn, and that was it. It had disappeared.
If I could just, Dr. Peter, real quick, if I could just get you, in wrapping up, to touch on what we in science call the kill rate with this new corona SARS virus type thing that we have going out there, because we have a lot of tourists that come from Europe, from North America, and if it left China at a 20-something kill rate, and now you can give the figure what it is in Europe, I think that should be concerning. So could you speak to that real quick?
Of course. You know, this coronavirus, I mean, about 15% of all coughs and colds are caused by coronaviruses. The problem with this particular one is that it started off with a 22% kill rate, but now in Saudi Arabia and in Western Europe, the kill rate, I'm afraid, is 52%. In other words, more than half the people that contract this virus will die. Now, if you scale that up, then that could be a major pandemic. So it's very important to try and protect your immune system against whatever is out there trying to challenge you, and you are being challenged every day. So this new immune product would be very good at protecting you from picking up any of those types of infectious organisms.
Thank you so very much. Peter Josling, of course, calling us from the UK. We're speaking on science-based medical solutions to the chronic non-communicable diseases. Now, there are 2 free health seminars coming off on June 15th, and that's Saturday at the Southern Palms Hotel Conference Room, and that's in St. Lawrence Gap. It starts at 4 o'clock sharp, 4 p.m. sharp, goes right up to 7 p.m. And Dr. Stan, tell us how we can get registered.
Registration is free. There's no costs. Again, we're going to be talking about getting iodine into the body, because iodine is in every single cell, and the deficiency in iodine causes a whole lot of medical health challenges that we know of: heart disease, diabetes, you name it, low IQ. We're going to be talking about this product that Peter Josling has formulated, which helps the immune system. That is very key. And of course, the introduction of a new modality in medical science right here in Barbados, the introduction of medical ozone therapy, which, by the way, and if folks email me, I can send you this handout. The back of this sheet is a whole list of disease states that medical ozone has been known to knock out completely.
Give us
the seminars.
Email address and contact number.
The email address is, yes, very quickly, thank you, is myhealthdoctor. Maybe they can put that up. myhealthdoctor@yahoo.com. myhealthdoctor, and doctor spelled out, at yahoo.com. There's also a website, www.naturalimmunesystemenhancer.com. Perhaps you can go to that, peruse, do some due diligence. But more importantly, folks, stop watching the TV for an hour or so. Come out, educate yourselves. 4 p.m. on Saturday, 7 p.m. is totally free. Do come out, get your questions answered. Invite someone, also a friend, to come. Particularly if you know someone that has a chronic illness, cancer, HIV, AIDS, diabetes, it doesn't matter. And come and get blessed.
For the good of your health, we want to thank you so very much, Dr. Stan. Stay with us right here on Morning Barbados. There's lots more coming your way.
Last call,